Hello and welcome. My name is Paige Burgess, and I'm the Community Engagement Coordinator at the Health Museum. It is my pleasure to welcome you to our Menninger Health Series webinar. Today's discussion, titled "My Child is Anxious or Stressed, Now What?" offers parents and caregivers mental health information through tips helping children cope with anxiety. We are pleased to be joined by Dr. Julie Skutch. She is a staff psychologist for Menninger's HOPE program for adults and is also an assistant professor at Baylor College of Medicine. Dr. Skutch's area of expertise, as well as her research interests, include treating personality disorders, trauma, and chronic suicidality. Along with several published works, Dr. Skutch has special expertise on topics ranging from chronic suicidality, identity development and dysfunction, dialectical behavior therapy, and identity disturbance. Please join me in welcoming Dr. Julie Skutch.
Hi, everybody. Thank you, Paige, for the introduction. It's nice to be here with you all today. Can you guys hear me okay? I'll assume that that's a yes, unless someone flags me down. So getting used to presenting in these virtual formats, but it's good to have you all here today. And I want to go ahead and just jump right into this topic. So we're going to be talking about what to do, and importantly, you'll see what not to do when your child is stressed and anxious. So what we're noticing in the field of psychology is that over time, anxiety, along with all mental health problems, actually are impacting kids and adolescents at increasing rates. So over time, kids are reporting more anxiety and depression too, but anxiety is one of the more common problems actually that begins early. And even when kids and adolescents don't meet criteria for an anxiety disorder per se, 1 in 3 do report feeling a lot of anxiety or stress. And there's some new research that's coming out looking at the past couple of years since the start of COVID in 2020. And what we're seeing is that the pandemic and related social stressors have actually contributed to kids' overall anxiety and well-being, and their parents too. So for many of us, we've been living in a more stressful time, and those types of social events impact our kiddos as well. So recently, in the spring of 2022, for the first time actually, there was a formal recommendation that all kids ages 8 to 18 be routinely screened for anxiety. So the same way that we screen kids for hearing and reading abilities and height and weight charts, we want to start paying attention actually to how they're doing with stress and anxiety. And part of the reason for that, one thing I want to share with you all today and really emphasize, is that catching anxiety and stress early is really ideal. We have lots of ways to help kids with anxiety and stress, and the sooner we start that process, the better it will be. So I want to encourage you guys to think about this in a similar way as you think about other kind of preventative routine healthcare stuff that you do with your kids. So I do want to reassure you as parents and caregivers that anxiety and stress are both completely normal. Anxiety is just a part of the body's normal stress response. And there's actually nothing inherently wrong with kids having some anxiety and stress. It actually is a healthy indicator that their system's functioning and they're awake and alive and paying attention to things. So it can become problematic if it becomes too intense or too prolonged, or kids really struggle to deal with it in effective ways, but there's nothing inherently wrong with having it. And it's actually a nice opportunity for kids. So, just like we're trying to teach our kids about dental hygiene and how to make healthy food choices and how to make good friend choices, we want our kids to essentially leave the nest armed with ways to know about their own anxiety and deal with it effectively. So as parents, you are also not immune to stress and anxiety, so you have some expertise in this area, and it's a wonderful time when kids are little to start helping them know what this is about and deal with it, like you're already doing with lots of other topics. So we'll talk a little bit later about when you should be worried about it and what to do if it seems to be a bit more than just normal anxiety and stress. But again, noticing it early is actually the best way to prevent diagnosable anxiety disorders down the road. And the other good news for parents is that often, it's easier to notice a change. So we'll talk today too about what to look for if kids are really having trouble with stress and anxiety. And so if you start noticing something new or different happening, that's actually the time to start helping kids, getting some extra help, doing some stuff with them. And so, you have lots of ways to be very effective if this is coming up for your kiddo. So let's talk about what it is, right? What are we talking about when we say anxiety and stress? So essentially, the stress and anxiety system are connected, and it's part of what we call the fight or flight system. So essentially, our brains are hardwired. We have this hardware and circuitry built in that gets us to pay attention to essentially threat, which is kind of a broad term for something going on in the environment that could be potentially problematic for us. And so as soon as our brain notices something like that, this anxiety stress response system is going to turn on, so to speak. And in a perfect world, we actually want our kids to have a pretty attuned stress response system, right? So when kids are little, right, we're teaching them about looking both ways before crossing a street. And if they're out playing and a big kid comes rushing by and knocks them down, they'll get afraid. And that's healthy because we want them to avoid those kinds of things that can hurt them. And then once the threat or the stressor passes, ideally we want that fight or flight system to actually calm back down. And so when we are talking about this reaction that happens, it impacts us kind of a full body impact. One of the things that we notice is in thinking. So if kids become stressed and anxious, they're going to start to have, well, adults too, it's actually quite common for all of us, is that our thinking really narrows and our brains really focus on the thing that's got us stressed and anxious. And that can turn into worry, where we think about that thing over and over and over again. And the more we worry, the more distorted our thinking can get. So we can start feeling like worst case scenario type thinking or assuming the worst about stuff. And then it also makes it really hard for us to pay attention. So if we're really stressed and anxious, it's hard to think clearly. We might have trouble remembering things. Anxiety and stress very naturally show up in the body as well. So with kids, we see this as a lot of trouble with sleeping or trouble with eating. They don't have a good appetite or they complain about headache or stomach ache. Kids can also have chest tightness or trouble breathing or increased heart rate. And those are some of the symptoms of anxiety when it becomes kind of intense. And sometimes kids might think is it asthma? Are they sick? So these are some of the symptoms that you might see if your kid is feeling anxious or stressed. And then emotionally, of course, what they're feeling is really fear. They're upset. It's hard to calm down. And you may notice that your child is more difficult to soothe than normal. The other thing we know about anxiety and stress, particularly if it hangs around for a while, is it leads to a lot of irritability because the nervous system is kind of activated, that fight or flight system's turned on, and it can just make us feel like we're on a hair trigger. And kids can also be harder to redirect if they're feeling a lot of anxiety and stress. So it's hard to get their mind off of it. It's hard to kind of move on from the thing that's stressing them out. And you may notice them returning to that topic or that content over and over. So the trouble with this very efficient system that we've developed to keep us safe from actual threat and danger is that it doesn't discriminate very well between things that could really hurt us and minor everyday stressors. So in our modern world, our kids are bumping up against things every day that are likely to kind of turn on that anxiety stress response system. And what will stress children out is highly individual to the child, and actually a good thing as a parent to start trying to figure out with your kid what are their triggers that get them stressed and anxious. Often what we see are kind of three broad areas. The first is around uncertainty. So changes, transitions, disruptions in routine, those things can trigger stress and anxiety because there's this component of uncertainty to it. And everybody's different, but a lot of us struggle when we don't know what's coming or we can't predict. The other big area we see a lot of stress and anxiety coming up is around academic performance. So increasingly, kids do feel more pressure about their day-to-day jobs. And sometimes that looks like grades and academics. Sometimes that looks like sport or extracurricular activities and their performance in those domains. And then the third relates to peer relationships. as children develop from being little toddlers up until adolescence, actually, their social skills are changing, developing, expanding. And over the developmental period from grade school until like leaving home at 18, kids are going to become more and more focused on peers. And that's actually really healthy. That's what they're naturally supposed to do in their development. So you kind of want them to do that. But along with that can come a lot more stress and difficulty navigating the increasingly complex world of peer groups and group dynamics. So the symptoms, kind of what to look for, how would you know if your kiddo is having trouble? They're actually much like they are for us as adults. So we all are familiar with stress and anxiety to some degree. And actually, some aspects of anxiety, like the tendency to feel intense physical sensations when stressed or anxious, like having stomach aches or sweaty, shaky hands, things like worry, those things actually have a fairly high genetic load. So it wouldn't be uncommon for a parent or caregiver to have a kiddo that might experience anxiety in a way that you can relate to. But things that you might be looking for, and again, as a parent, what I really want you to be attuned to are changes. Your kid's kind of going along, things are fine, then you see changes in sleeping or eating, or sudden weight gain or loss, or increased moodiness, right? Like maybe you kind of know what their temperament's like in the day to day, but then suddenly it's like they're becoming more moody or more irritable, and you're not sure what's going on. Excessive worry is another symptom. And it kind of tells us that your child might be having trouble like turning off that anxiety stress response system. So the brain can get kind of stuck in a groove where it thinks about the same stressful, upsetting thing over and over again. And all of this can lead to changes in performance. So if your kid normally makes good grades, they go to school without complaint, and then suddenly they're not doing as well, or teachers are expressing concern, or grades are falling, that might be an indication that they're just a little too stressed out. They can't manage it very well. And then social changes. So withdrawing and isolation is a big one. Sleeping a lot, or maybe your child's usually out and about during the week, but now you notice they're home more and you're not sure what's going on. And then poor self-esteem is one to kind of be looking at as kids go through development, particularly at times of transition, like moving from grade school to middle school, or coming into an age where puberty is starting. And what you want to be looking for here around self-esteem is like comparisons to other people that are unfavorable. So if your child's talking about other kids being really talented or really pretty, but I'm not, or being down on themselves, so negative self-talk. Other trouble that you can notice around self-esteem issues are if they're having a really hard time making friends, whether that's bullying or just like a hard time kind of getting themselves engaged in social groups. And then sensitivity to criticism. So, a lot of the task of childhood is to learn and grow and improve skills. And with that comes a lot of feedback from various people. Parents have to give feedback, teachers have to give feedback, peers give a lot of feedback. So if your child's really struggling to make sense of that, or feeling really wounded with a lot of kind of normative types of feedback that they're getting, that could be an indication that they're having trouble coping with that. So kids don't have the same resources, like mentally, and the ability to put words to the experience, but as we do. But you guys can really collaborate, parents and caregivers and their children, because you as parents do kind of know something about what the experience of stress and anxiety is like. So that's what you'll be kind of trying to help them with as you monitor for these things, and then moving into how to be helpful. So before we talk about that, I actually want to spend a minute talking about what not to do, because this is actually probably one of the most important things for you to take away from today's talk. So anxiety is completely normal, right? So then why do we have so many anxiety disorders that people can wind up diagnosed with? And often what winds up happening is that the way we cope with anxiety becomes much more problematic, actually, than the anxiety itself. And the reason for this is that the two most natural responses, like the knee-jerk reaction to anxiety, actually makes anxiety worse over time. So the first is avoidance. And this you can see is very understandable. So if I'm a kid and I've started on a new soccer team. I'm not feeling very confident. I don't think it's going very well. And practice is coming up at 3 o'clock. I might start to think of reasons why I can't go to practice, right? The natural tendency is to move away from things that distress us or freak us out or make us feel stressed. So that's very natural. The other normal response is control. So this can look kind of subtle. It could just be like kids putting their foot down, or little kids maybe throwing tantrums, or kids wanting to have things a certain way. So maybe you've got a child who really likes to have sleepovers and play dates, but they're not willing to go to other kids' homes. They want to have them at your house. And so if kids wind up getting stuck in coping through avoidance and control, that's going to send them into like a much more problematic direction down the line and make it harder for them actually to deal effectively with anxiety and stress. So even though this is very normal, we actually want to help our kids stay out of getting into a cycle of relying on avoidance and control to manage difficult feelings like anxiety and stress. So if it's so normal, what's the difficulty with it? So essentially what will happen is that in the very short term, avoiding and controlling will provide immediate relief from anxiety. And all of us know how difficult it is to have anxiety. Like the feeling of being really stressed out is very unpleasant. So that's why it's natural to try to want to like get rid of it, avoid the things that are bothering us. The trouble is that when kids or adults too avoid and then we feel better, it sets us up in a pattern where then our brain is going to want to continue to avoid. And over the long run, what we know from the research actually is that using avoidance and control will actually increase the amount of anxiety that we have and how intense it feels. So while it's understandable, we just really need to help our kids kind of not get into that pattern. And it's easier to do that if we catch it early on and help them learn some other ways right away. So the thing is, though, that it is very hard for parents and caregivers to see their kids stressed out and anxious. And so it's very easy for us to fall into a pattern of supporting coping through avoidance and control. And the other thing is just real talk for a second is that kids who have a lot of stress and anxiety can, like the ways that they try to deal with it can actually be a bit annoying for parents. So what I mean by that is a very common kind of way that kids will start to deal with too much anxiety and stress is a lot of reassurance seeking. And even when you reassure them or go over things with them again, they continue to ask and seek more reassurance. And that can actually really be frustrating or bothersome. The good news about that actually, though, is that it's likely to get your attention. And so if you can use that as kind of like a red flag, like, why does my kid keep asking me if I'm going to be picking them up and taking them to swim practice? Like we've gone over this a million times. That's a cue for you that like their brains might be getting stuck in one of those worry loops. The other thing that can really disrupt the household and concern parents is when kids start to want to quit activities or withdraw from routines because that you're trying to teach your children commitments and practice and hard work ethic and that kind of thing. And you might have many kids in a busy household and a busy life. And so a sudden, like, can't go to school or need to be picked up, more often with a stomach ache becomes a difficulty. So just use those things as cues that maybe something's going on and your kid needs some extra support. Ultimately, avoidance and control are also going to keep our kids stuck and make it harder for them to develop independence in the natural progression over their developmental age that we want them to do. In the long run, the trouble with avoidance and control is it's going to lead to inflexibility. So if we don't redirect kids early, they're going to fall into this pattern of needing to have things a certain way or needing to avoid things to feel okay, and that's going to get in the way later. The other thing I want to point out is that there's a couple of things that can be easy to miss. And one is perfectionism. So we know that perfectionism shows up as a way to control things or as a way to soothe feelings of insecurity. So like if I'm a kid and I'm really anxious about my schoolwork, I'm anxious about my grades, I want to go to a good college, and I get really stressed and upset about schoolwork. If I really throw myself into keeping very high expectations, like making A's on all of my exams and doing really well in school, I can easily develop perfectionism that then saves me from having to deal with the stress of not doing well or not making good grades. And my parents might be delighted by this because I'm bringing home all A's on my report card. So perfectionism can be slippery. It can be hard to notice. But you want to just be attuned, like, does your child feel pressure? Are they being self-critical? Are they staying up late or driving themselves to do the best all the time in school or in sports? And do they get really upset when they're not absolutely making an A or performing at the level that they're expecting themselves to? So that would be an indication that you might actually have some avoidance and control going on as a way to cope with stress. And then underperformance is really about a child who is not performing to the level of their capability. And this can be really tricky to sort out as a parent. Actually, a lot of times it's like, do I push my kid to take AP classes, or do I let them have a little bit more relaxed academic year and just have them do well in the regular curriculum, right? So these things can be hard to sort out. And it can be really helpful to use feedback from teachers, coaches, maybe other adults in the child's life to kind of calibrate these expectations. But both driving oneself to excellent performance and playing video games instead of studying, like not performing as well as you're able to, can be symptoms of anxiety and stress. And over time, if we get stuck again in this pattern of avoidance and control, it makes kids more susceptible to being diagnosed with an anxiety disorder down the line. All right, so in a nutshell, what we want to do instead is kind of a three-part thing. The first is, as parents, the first thing to realize is that your kid having anxiety and stress is normal. They're going to their whole life. You may feel an urge to want to protect them from that or really get rid of it for them because it's so hard to see our kids struggle. But instead, really modeling for them that it is normal and inevitable to have some times of anxiety and stress. So you have so much power to help them manage it in a way that's going to really help their long-term mental health and also build their confidence. So the first thing to kind of communicate to them is like, yes, you are anxious, you are stressed, that's part of life. We're going to work on that together. The second important piece is that we need to help our kids actually build the capacity to tolerate the feeling of anxiety. So whether your child is one that worries a lot and has a lot of the cognitive symptoms, or maybe your kid is one that has a lot of the physical symptoms, they always have a stomach ache, they can't sleep, they're really tense and irritable, or they're just really fearful and they find it hard to do stuff. Whatever those, the experience of anxiety for them, we want them to build their muscles for being able to kind of tolerate that. Because if the experience of anxiety freaks them out or feels so unbearable to them, they will be prone to push it away and be more likely to use avoidance and control to cope because it feels too bad to tolerate. So we want to help them with that. And then the third part is really to model and support them in going on about life. And essentially that means coping effectively. And we've talked in just a second about some practical ways to do that. But the attitude is stress and anxiety come with life. We don't want it to completely derail us. We want to try to move forward and deal with it effectively. And so that means not avoiding. And it's really going to foster resilience because your kid's going to learn, okay, this feels bad. I don't like it. I want to just avoid this whole thing. But mom, dad, caregivers, they're helping me move forward with this. And that's going to be fundamental when they get older. And as parents, you're already doing this kind of thing with lots of other things in your life, right? Kids that they're learning lots of new skills with a lot of help from you. And so in many ways, anxiety and stress is the same. So you're going to talk to them about it. And I want to encourage you to show them how to do it and then join them in doing it. So what I mean is that this is something you can do with kids, probably, especially for little kids, you'll need to model it for them. And then as they get older, just like with other things, supporting them with it. So when kids are really small, we have to kind of brush their teeth for them. Then over time, they're brushing their own teeth, but we're checking in to make sure that's happening at least once a day. And then eventually we're just kind of checking in to see if they need any more toothpaste from the store next time we go, right? So when we're thinking about healthy coping with anxiety, it's the same kind of scaffolded process that you will join your kid in doing. And it may not be specific age. So if you've got, say, like a 12-year-old or a 13-year-old and stress and anxiety is new to them, you may be really helping them a lot in the beginning, learning some skills. And then as they can do it more on their own and they're feeling a little more confident, you kind of pull back like that and support them in doing it a little bit more on their own. So as parents, you kind of feel that out based on how your kid is doing. So let's just talk practically for a few minutes about like, what do you do? Like when the rubber hits the road and your kid's really upset or they're really stressed out, like how do you help them? So the first thing I want to say is to really try to listen. And the reason I say this is that, in busy life and especially depending on the age of your kid, some of the stuff that they will come to us with that they're really, really stressed about, it doesn't land on our adult brains as being super hugely important, right? Like if they didn't get enough field time at the recent sports game, or they were the last one to find out about a classmate's birthday party or something like that. Sometimes our adult brain just automatically kind of makes sense of that situation and we'll think of some practical reasons why that might have happened, and it doesn't land the same way with us. And we may get pulled into kind of like helping our kids rationalize through it, right? Like it's not that big of a deal. Maybe it's not worth getting so upset about, in an effort to kind of help our kids not be so distressed. The trouble is that our kids can learn that they're overreacting, or they don't really learn to understand, oh, I got really stressed and anxious in response to this particular stressor. So in the listening phase, we really just want to try to understand their experience. What are they thinking? What are they feeling in their body? Are they having any of those physical sensations? And what are they feeling emotionally? Like, did they get really scared or tearful or upset? The other reason we want to do this is we want to actually help our children develop language to notice their experience of stress. Like, how do we know when we're anxious, right? If you think about how do you know when you're stressed out and why do you call it stress? We want our kids to have that same skill set. And that so then they can come to you and they can kind of talk to themselves about, oh, I'm feeling really stressed out. I need to do something to help myself. Another practical strategy is what we call cope ahead in psychology. So you talk through the situation or scenario that's causing anxiety, and you kind of walk through it together, you talk about it, you imagine coping successfully. So say they're going to go to a dance and they're worried that, they won't be able to ask somebody to dance, or their friend group will tease them or something like that. So you kind of walk through, well, what would you do if so-and-so says X, Y, Z? What about saying this? What about saying that? So sometimes that kind of imaginal coping can be really helpful because it gives our kids like a sense that they know how to handle it. So the thing they're worried about is the uncertainty that the situation could go wrong. And if we kind of think with them about, well, what would you do if it did go that way, can make them feel less anxious. The other thing is to really just prepare. So when you have a specific stressor, you want to actually help your child approach that stressor slowly and with support. So for example, if you've got a kiddo who routinely struggles with transition and they're going to be going into a new school, or you guys are going to be moving homes, it's a great idea to just, in a kind of casual way, like drive by the new school or drive by the new house or talk about the new situation. Maybe you get them together with some new kids that they're going to be going to school with at this new place. So in other words, before the stressor happens, that the new school starts or the new sport begins, you're helping your kid kind of like approach that situation with your support in a way that's kind of paced, or at a good pace that doesn't completely freak them out. And that can really be good for anxiety. And then sometimes just practically problem solving is really what's needed, because sometimes there's something really concrete that's contributing to anxiety. So for example, if you've got a child who becomes really anxious about math tests, right? And you guys talk about it and it seems like they're really struggling with the concepts, that's a pretty easy problem solving. It's like you can listen and validate their worry about it, and then maybe get a math tutor or talk to the teacher or sit down with them and help them with their homework in the evenings, those kinds of things. So in other words, the skill deficit, the problem learning the math is what's contributing to the anxiety. And you might need to problem solve some of the triggers around anxiety. And then the last thing is really to model for your kids. And this is something where I hope you guys can look for opportunities to join them in taking a break from it. This has to do with really modeling balance and letting kids know that, yes, stress and anxiety comes up, but we don't want it to completely torpedo life. And so it can be really nice to just take a break from both the feeling of being really anxious and the thing that's bothering you. So maybe that's just having some fun together, or preparing their favorite meal with them, or having a backyard barbecue or something simple at home that can be relaxing for the family and the child. And then also really celebrating their strengths and wins. So again, this idea of balance, right? We want our kids to identify it and acknowledge the things that stress them out and use coping to deal with those things. But it's also important that they focus on other things too, maybe even things that are going well, and that you help them kind of notice that it's good to take a break and have some fun as well. So a lot of parents get worried or confused about, like, well, how do I know if it's just like normal stress and anxiety versus this is something more serious than that? And the thing I want to really tell you is just to trust your gut and don't worry about getting it wrong. Like, err on the side of, I think we should maybe talk to somebody about this. So if you feel like you've tried some coping stuff, you've tried some to help your kid with some support, problem solving, and there's been some change, or they're just really focused on something right now that they're not like calming down, I think that that's a time to think about maybe increasing the amount of support you give them. And we'll talk next about like what kind of resources that might be. Also, if you feel like their fears are just really magnified and way beyond the situation, like if you notice that they're coming home really upset about something going on, like with a peer or with a class or something, but very quickly they're spiraling into like failures in the future, or somehow this is going to have a really drastic negative impact, that's kind of a red flag that the anxiety might be getting pretty intense and they might need a little bit more support. And then anytime you're seeing that their functioning is impacted in like a big way, like maybe one day they have an off day or they don't do as well at school on a test or something. But if you start noticing that more consistently their academic, extracurricular, or social functioning is just different, it's not going as well as it was, that's a time to maybe become a little bit more concerned about how they're doing. And then panic attacks or persistent physical symptoms. So this could just be trouble sleeping or trouble eating that's lasted like more than a couple weeks, or actual panic attacks, which are these really intense, kind of sudden experiences of like a flush of anxiety in the physical body. So it could be like chest feels tight, or heart's racing, or feeling shaky, or crying, feeling like, I don't know what's wrong, I feel really scared all of a sudden. So those kinds of things we think of would be like kind of a red flag to maybe get a bit more help. And if you find yourself thinking about it, like maybe there is a need to have a little bit of more support for my kid, the first resource you have available is your pediatrician. And talking to the pediatrician about what you guys are noticing, and should, like, is it time to see a therapist or to get a little bit more help, is a good place to start. And then the other thing that I advocate, and of course you'd have to acknowledge that I'm biased because I'm a psychotherapist, but psychotherapy is really, really good for even for little kids. So there are providers in the community that are trained to work with kids of all ages. And we have wonderful data, like some of the best evidence we have for the effectiveness of our interventions in psychotherapy is for anxiety. And so psychotherapy, sometimes we call it talk therapy, is just your child going in to meet with a counselor or a psychologist or a psychotherapist and just talking about what's going on and learning some ways to deal with it. So what's good about seeking help, particularly early, several different things. One is, again, we know that if we intervene as early as we can, kids and adults, but we all tend to have better outcomes. So getting some help on the front end is better actually than waiting a long time to see if it resolves, or letting it go on for a long time, because then things can become a pattern. And it's also nice to be able to call in the professionals, because parenting is really hard and you have a million things that you have to juggle. And if you're doing your best to try to help your kid and it's not enough, calling in some reinforcements can help you stay in the role of parent, right? And decrease any tension that's coming up as you're trying to help your child. And it's good to know that it's not a failure, right? If you've tried to help the kiddo and it's not really working out and you guys are feeling stuck, it's just, means that they might need a little bit more help. And a trained professional will also hold you in mind. So if you see a therapist in the community who's used to working with kids or adolescents, there's a way too that they can kind of help you and the child work together on this when you go back home. So typically interventions for children are very supportive of the relationship with the parents. So sometimes parents become worried about seeking mental health care for young kids. There can be an idea that maybe it'll make the problem worse, but we don't have any data to suggest that that's the case. It's just really a conversation. It's a pretty benign intervention to have at least one visit with a psychotherapist to let them kind of get eyes on the situation and see how your child is doing. And there is a difference between medication interventions and talk therapy. So medication interventions are typically provided by a psychiatrist who specializes in child and adolescent psychiatry. A psychiatrist is a medical doctor who prescribes medications typically to help with mental health problems like anxiety. But a psychotherapist doesn't prescribe any medications. So if you were to seek out a counselor or a therapist, it would just be an interaction kind of like this, kind of like talking to somebody, rather than any kind of medications. And, as parents, you love your kids and care about them a great deal. And it can just be really nice to feel, for both you and your child, to feel like you're being effective in managing this problem that might crop up. So let me stop there because I want to make sure we have time for questions and see what questions you all may have. Paige, are you there still?
Yes, I am here. We did get a few questions, and so I'll go ahead and read Nancy's first. It's she's asking, what if the stress or anxiety is originating from the relationship trouble within the parents, or when another sibling is already dealing with a lot of anxiety?
Yeah, that happens, right? And I think that's one of the good times to reach out for help from a therapist, because it's not uncommon for kids to have trouble with family members and relationships at home. And it can feel really bad for the parent and the kid, but it's actually a really good opportunity because kids are going to have we all have problems in relationships from time to time. And it can be really nice to have an outside perspective who can help. So again, providers that work with kids and adolescents are typically quite attuned to supporting the relationship between the caregiver and the child. So when you take your kid in, they're going to be the ones getting some help in the talk therapy that they have. But that provider will also be trying to think about how can they support the whole family in dealing with the trouble. So if there's conflict with a sibling, or the parents feeling overwhelmed, trying to help more than one kid with anxiety or depression or something, that provider can really help the entire family. And it's a great time to get some extra support. Oh, you're muted, Paige.
Thank you. Thank you for answering that question. We do have another one from Rachel Garza. She said, my son began stuttering. Should I take him to his pediatrician?
How old?
I guess you'll.
It'd be good to know how old, but in general,
7 years old is what she said.
Yes, then in that case, I would. So that's a good example of a time where you're seeing kind of a new problem, an onset of an issue. On like new changes, like new difficulties, those are great for parents because parents are usually really able to notice those, and it's best to get those just checked out. Yep, and pediatrician is a good first step in checking that out. There can be more than one reason why a child might start stuttering, but again, catching it early and going ahead and seeing what to do about that can be really helpful.
Thank you for the question, Rachel. We have one from Jill asking, what tips do you have to pick the right therapist for your child?
Yeah, that can be tricky, actually. And if you've ever tried to find a therapist for yourself or others, it can be hard to know that there's often lots of options usually one of two problems. Either there's lots of options and it's like, which one do I choose? Or maybe you live in an area or you have an insurance plan where there's not a lot of options. So it's a great question. I would first recommend asking your other providers that you're already connected with. So like your pediatrician might have a list of trusted people that they've had great experiences with and can recommend that you try. Your school counselors or teachers, people like that, may also have some good resources. Sometimes you are confined to using like an insurance list, and it can be helpful to like start there because it's a more narrowed down list that's going to offer you best cost effectiveness. One thing I do recommend is trying to find someone who's got some training and expertise for the age that you're looking for. So it's best to see like a child therapist or an adolescent, a therapist that works with adolescents, that kind of thing. You can also check within your own group of friends and peers, right? So if you have other parents, and a lot of times people don't talk about anxiety and depression, there's still stigma around mental health. So even though we might easily talk about which dentist we use or that kind of thing, maybe you haven't heard about anybody taking their child to a therapist yet. But if you're feeling comfortable enough to ask, it can be great to ask other parents or family members who might know somebody like that. If you're not getting names like that when you call to therapists, just go ahead and ask them some questions. It's totally fine for you to have like a 5 to 10 minute, it's a reasonable expectation to have like a 5 to 10 minute phone call with a potential provider. Ask them what their experience is. Do they treat children the same age as your kids? And how do they approach these types of issues? And have they worked with a child with anxiety or test anxiety or whatever the issue is your kid has? And feel out your gut. And if you feel comfortable, proceed. And if there's something that's telling you it's not a good fit, it's okay to look elsewhere.
Thank you for your answer, Dr. Skutch. Jill, we hope that helps. The next question is coming from Ellen. She's asking 2 questions. The first is, how do you help children who are anxious but lack verbal skills because of their age and level of development? And can they benefit from talk therapy?
It depends on the age of the kid, and it's a really good question. And I appreciate so much you're paying attention to the fact that you will need to kind of tailor things to the age of your child. So when kids are really little, like 2, 3, or 4, maybe they don't have a lot of language skills, or maybe they're older than that, but for some reason they don't use a lot of language, we can put some words to it for them. And so sometimes when kids are having their experience of stress anxiety, they don't know what to call it. Now you may decide like to name it something. Like sometimes, as parents, we can come up with like shorthands for things. Like, do you have the grumps? Like, what's going on? That kind of thing. But it's good to teach kids, like let's say you've got a little kid and they've been clingy and whiny and they don't want to go to bed, and you've got like a family trip coming up, or you're going to be out of town, or school starting. It's good to just start talking with them. Like, how are you feeling? Does your tummy hurt, or you're having trouble falling asleep? I wonder if you're feeling nervous about school starting, right? So they don't really know what nervous means yet, but you're connecting the dots because they're probably aware of whatever the stressor is, and they need some help actually putting words to it. So you can try that, but there's also nonverbal things that you can do. And this is partly why it's important to find a therapist, if you go that route, that has experience working with the age that your child is. So with little kids, we might use some art and like have them kind of show us by coloring it. They don't have to use as many words. Like draw on this paper, like how you're feeling, like your frustration, like whatever they're able to notice, whatever you guys can agree on that's going on that's distress for them. Or maybe even like playing, actually going out and getting some of the anxious energy off, and that type of thing. So in some ways you can adapt this stuff. Kids that are learning verbal skills, so 3, 4, 5, can start to be helped by talk therapy. It just needs to be adapted to their developmental level.
All right, thank you for that response. Thank you for your question, Ellen. The next question is asking, my son is 4, shares often that he feels sad. Is that an indication of anxiety or something deeper? If so, what would you recommend?
Yeah. So actually, I do want to say that as parents, one thing we know from the research and in psychology, every generation is like more aware and talking about these kinds of things than the one before. So I think it puts parents in a challenging situation sometimes where you can get caught off guard by like having a really little one talk about feelings. Now, every family is different, and some families are doing that work with their kids as part of the way they raise them. But yeah, it's normal to be like, wow, should I be worried? and my kid's really little and they're talking about sadness. So what I would say is find out from him what he's sad about, like what's going on. And if you feel like there's a good reason for it, like maybe your family's going through some stressors, or he may be reporting sadness about things that seem really reasonable, then just help him through that and like talking about that with him. But if you feel like it's coming up a lot and it's not clear to you why he would be feeling sad so often, it might be worth a conversation with the pediatrician at the next visit, or maybe even reaching out to a counselor just to kind of see what's going on there. Sadness is, sadness by itself is a normal, healthy emotion, and our kids will feel that, and that's fine. And it's wonderful, actually, that he's talking to you about it. That's really great. So you're on the right track, and supporting him and like listening to him and tell me more about what's going on. Why are you feeling so sad? Validating that. And then some of the practical strategies that we went over today that you can use for anxiety, you can also use for things like sadness. But if you feel like it's persisting and it's somehow niggling at you in your gut as a parent, like it seems like it's more than you'd expect, you go ahead and get it checked out. It's kind of like just going in and getting like the height and weight stuff checked out. It's like going in to talk to a therapist just to see if this is within the realm of what you'd expect for your kiddo.
All right. The next question is from Mercedes. She's asking, would a play therapist be best for a child?
It's a good question. I don't know enough about whether like a play therapist who has specialized training in that modality would be better than another child therapist who doesn't have specific training in play therapy. It may be a bit of a choice of like what you are comfortable with, what you feel like your child might do well with. Play therapy, though, it is used with little kids with some evidence for its effectiveness. So if you're drawn to it, if you like the idea of it, and you find a provider who does that type of therapy, I think it's fine to try it out. It's also a fair question to ask the provider. So as a therapist, I get questions all the time from people that I'm working with. They're like, what kinds of treatment do you do? What kinds of treatment do you recommend for me? And I get feedback. Now I work mostly with adults, but even with adolescents, they'll tell me like, I don't want to do that, Dr. Skutch, I want to do this other thing instead. So as a consumer, it's totally fine for you to have these questions and to take them to the providers. And, as a therapist, I'm open to that. And we're trained to be open to that and to educate and talk to clients and their families about what we offer and what we recommend. So if that would be a green flag, if you were to go to someone and say, is this the best thing for my kid, or do you think something else would be helpful? And you get a pretty open response, even if that means a referral elsewhere, that's a good sign. And it's fair to kind of ask those questions before you, commit to a provider.
Thank you. Our last question says, my son is 12 and I know he gets anxious, but when I ask, he says, quote, I don't know. We have gone to therapy, but it's really hard to get there consistently and he is functioning well. Any suggestions on how to help him identify what he is worried or anxious about?
Yeah, I don't know is a common problem. And 12 is an age where kids are, so I don't know if this will be reassuring or not to parents, but as kids hit 12, 13, 14 and on, they start to kind of pull away from parents and be more engaged with peers for like support and connection and that. So it's a tricky time in middle school to be a parent and a child, we'd have to say, but to be a parent. So I don't know, could be like, I don't have words for it. I don't know how to talk about it. It could be an indication of some discomfort in talking about it, like with you for whatever reason. And again, that can just be really normal, not an indication that you're doing anything wrong as a parent. One thing I like to do when I have someone who says I don't know a lot is to provide a choice array. So you can start by saying, well, you've had X, Y, and Z going on this week. Have you noticed thinking more than usual about one of those things by chance? Because that would give you a sense of like, if your child says, yeah, I've been thinking a lot about my soccer match on Friday. Okay, then I wonder if like that might be what's stirring up your anxiety. So you're kind of putting the pieces together that way. And so offering choices and just some reasonable guesses that you make as a parent, and then seeing if your child is like collaborative and willing to like think through those with you. If you keep finding that you're bumping up against, I don't know, and it's coming with some body language that's like not interested, that might be an indication that maybe there's some discomfort talking about it. And you could ask that too. Like, would you rather talk to somebody else about this? Like, is there something going on that it's a little uncomfortable to talk to me about? And that might help know kind of what might be going on. Uh, and so just really kind of trying to give kids some language. And as parents, we might have to provide it first. We might not be exactly right. That's okay. Like just kind of seeing with them, like, I wonder if it could be this, or, in the past when you've had a big test, you felt like this. Do you have any tests coming up? Those kinds of things. It's very tricky that I don't know.
Yeah. And that's what I was kind of thinking during your presentation, like what is the line between puberty symptoms versus like, okay, this is something a bit more serious. So like you touched on that.
Yeah, that's a really good point because I say like the change, like paying attention to changes, because that's in some ways an easy marker for parents. That parents are usually pretty attuned to that. But yeah, with puberty comes all kinds of changes and moodiness and sleeping more and all that. So again, what you want to try to do is just open up a dialogue with kids, like normalize in your household. We talk about stress and anxiety, and once if you're able to do that, then once you notice something like that, you can kind of talk to kids about what's going on. They're also not totally disconnected. So kids might be more stressed and anxious because there's a lot of physiological stuff going on. And so sometimes it's helpful just to be there with that, right? Like kids are, however you're talking about that stuff, like the body's growing, there can be physical symptoms and changes, and that can make us irritable. So let's do some stuff together. Why don't we have some fun tonight? We'll do movie night, or do you want to have some friends over, or let me help you with your homework because you seem kind of overwhelmed, right? And so even if it is just, and so if you take those approaches and things kind of even out, great, keep doing what you're doing. If you take those approaches and it's not getting better, it's time to call it for some help, right? And so that might be a conversation with a pediatrician. And then, like, is this something related to puberty or growth or whatever? And it may be a conversation with a therapist. But I just urge you to trust yourself because you know your kids well and you've been with them for a long time. And so you'll get a sense in your gut of like, what, this doesn't seem right, or it's not getting better.
All right. Thank you everyone for your questions. And Dr. Skutch, thank you for joining us. This has been such an informative conversation, an important conversation. And so we thank you for sharing your expertise. The Health Museum is offering more of these talk series with Menninger. So thank you again, Dr. Skutch, for your time. And thank you everyone for joining us today.